What I'm about to show you is going to make you question every single morning you've ever woken up with a mouth that felt like sandpaper. And when I reveal the number one reason this happens, the one seniors dismiss as harmless all the time, you're going to understand why something as simple as dry lips on your pillow can sometimes be the first visible sign of a much bigger problem. If you wake up thirsty, sticky-mouthed, hoarse, or strangely tired, your body may not be asking for a sip of water. It may be asking you to pay attention before something more serious gets missed. I'm Dr. Michael Joel, and I need to tell you something that most people do not hear soon enough. Persistent dry mouth in the morning is not just an annoying part of getting older. That belief is one of the biggest reasons important clues get ignored in adults over 60. I've seen seniors blame the weather, the heater, the bedroom fan, or simple aging, only to discover later that the real cause was medication, uncontrolled blood sugar, a blocked nose, an autoimmune condition, or even sleep apnea. And by the time they found out, the damage had already started in the mouth, the teeth, and sometimes far beyond. Before we begin, please subscribe to my channel for health guidance that helps you protect your body every single day. And stay with me because by the end of this video, you'll know the 8 hidden messages dry mouth and cracked lips may be sending you, which one is the most dangerous, and exactly what to do tonight, tomorrow morning, and at your next doctor's visit. Because once you understand what saliva actually does and why losing it overnight matters so much, you'll never look at this symptom the same way again. Let me start with Carol in Phoenix, Arizona, because her story reveals signal number 8, and it seems so innocent that almost everyone shrugs it off. Carol was 69, retired, healthy, organized, the kind of woman who still ironed pillowcases. Every morning she woke up with dry lips, a parched tongue, and a throat that felt scratchy. She figured it was the desert air. What else could it be? She kept a glass of water by the bed, took a few sips, and moved on. But week after week, the dryness kept getting worse, especially after warm nights and after running the heater. Signal number 8 is simple dehydration, often made worse by dry indoor air. During sleep, you're not drinking for hours. Your body is still losing water through breathing and normal body functions, and if the room air is dry, you lose even more moisture from the mouth and lips. That's why your lips crack first, because they have less protection than the inside of your mouth. Carol wasn't in crisis, but her body was giving her an early nudge. Drink too little during the day, use a drying heater at night, and the first warning may show up right there on your lips every morning. But here's what I need you to understand before we move to signal number 7. If simple dehydration is the cause, the dryness usually improves when hydration improves and the air gets less dry. If it doesn't, your body is often telling you something else is interfering with saliva or airflow. That distinction matters because people lose months, sometimes years, assuming they just need more water, when the real issue has nothing to do with a forgotten glass by the sink. And signal number 7 is one of the most common reasons that happens in seniors, especially those who snore. Let me tell you about Frank from Tampa, Florida. Frank was 73, a former Marine, tough as nails, and convinced dry mouth was just part of sleeping hard. His wife kept telling him the bedroom sounded like a chainsaw factory. He snored, slept with his mouth wide open, and woke up every morning with breath so bad he wouldn't speak until after brushing. His lips were splitting at the corners. His tongue felt thick. And yet he kept saying, "I'm fine, I just need stronger coffee." But his body had already been telling him the truth for years, and nobody was listening. Signal number 7 is sleeping with your mouth open. Mouth breathing dries the mouth incredibly fast because the moisture that's supposed to stay inside is exposed to moving air for hours. Saliva evaporates. The tissues dry out, the lips chap. The throat gets rough. And because saliva helps control bacteria, the mouth can smell worse in the morning and the risk of cavities rises. This is why some people wake up with a sticky mouth, drool on the pillow, and bad breath all at the same time. Frank didn't have a water problem. He had an airflow problem that was draining moisture all night long. Now here's where people get confused. They say, "Fine, I sleep with my mouth open." But why? Exactly. Because mouth breathing is often not the real root cause. It's the result of something forcing you away from normal nose breathing. And that leads us straight to signal number 6, which is more hidden than people realize. If your nose is blocked, your body will choose airflow over moisture every single time. It will sacrifice your mouth to keep oxygen moving. And if that's happening nightly, dry mouth is no longer a random symptom. It becomes a clue. Linda in Columbus, Ohio, taught me that lesson again. She was 71 and had started waking up with a dry mouth every spring and fall. Some mornings she also had a mild headache, a hoarse voice, and lips so dry her lipstick burned. She thought it was menopause residue, then aging, then maybe one of her vitamins. But when I asked about nighttime congestion, she paused. "Well, my nose is always stuffy when I lie down." There it was. Allergies and chronic nasal blockage had quietly trained her to breathe through her mouth for hours, especially when the pollen count climbed. Signal number 6 is blocked nasal breathing. Allergies, sinus swelling, chronic congestion, a deviated septum, even lingering inflammation after a cold can force you to sleep with your mouth open. Your body is not trying to create dry mouth. It's trying to keep air moving the only way it can. But the cost is steep. When Linda treated the congestion and improved nasal airflow, her mouth dryness improved too. That's why I tell seniors not to focus only on the mouth. When your mouth is dry in the morning, your nose may actually be the part of your body asking for help. But the next signal is even more important because it fools good patients and good doctors all the time. This is the one I see most often in adults over 60, and it causes so much confusion because people don't connect the symptom to the pill bottle. Signal number 5 is medication-related dry mouth. And if you miss this, you can spend months blaming the weather, your mattress, your bedroom, or your age, while the actual cause is sitting in your medicine cabinet every single night. Let me show you how that happens, because this story is far more common than you think. Robert from Des Moines, Iowa, was 76 and took pride in staying on top of his prescriptions. Blood pressure medicine, a bladder medicine, an allergy tablet at night, and something occasional for back pain. He started waking up with a mouth so dry he kept gum in his robe pocket. Then came the cracked lips, the sore tongue, and trouble wearing his dentures comfortably. He thought it had to be dehydration, so he drank more at bedtime, which only made him get up to urinate more. The dryness worsened, his sleep got worse, and the cycle kept tightening around him. Here's the problem. Hundreds of medications can reduce saliva, and many of the most common ones are taken by seniors. Medicines for blood pressure, depression, anxiety, allergies, congestion, pain, and bladder control. When several are combined, the effect can stack. That's why someone can feel fine for years, add one new prescription or over-the-counter medicine, and suddenly start waking up with a dry mouth every morning. Robert didn't need guesswork. He needed a medication review. And let me be very clear, never stop a prescribed medicine on your own. But if dry mouth began after a change, your body may be waving a red flag. Now we're moving into more serious territory because signal number 4 can point to something happening in your bloodstream, not just your bedroom. Let me tell you about Evelyn from San Antonio, Texas. Evelyn was 67, still working part-time, still sharp as a tack, and she kept waking up with a dry mouth so intense she said it felt like cotton packed behind her teeth. She also noticed she was thirstier during the day, using the bathroom more often, and feeling oddly drained by afternoon. But she thought, that's just stress. It wasn't stress. It was a warning her body had been repeating every morning. Signal number 4 is that your blood sugar may be running too high. When blood sugar rises, the body often tries to get rid of excess glucose by increasing urination. That can pull more fluid out of the body and leave you thirstier and drier. For some people, morning dry mouth is not the only clue. It shows up next to frequent urination, fatigue, blurry vision, slow healing, or unusual thirst. Not everyone with dry mouth has diabetes, of course. But if you wake up dry and you've also noticed those other symptoms, this is not something to shrug off or postpone. And here's why that matters so much. Seniors often separate symptoms that actually belong together. Dry mouth seems dental, frequent urination seems bladder-related, fatigue seems like age, blurry vision seems eye-related. But the body does not organize warning signs by specialty. It sends them wherever it can. So if your mouth is dry every morning and your body is also giving you thirst, urination changes, or unusual tiredness, that cluster deserves attention quickly. You're no longer looking at an isolated annoyance. You may be looking at a metabolic signal that needs proper testing, not a stronger lip balm. Now let's go one layer deeper, because signal number 3 is the part almost nobody talks about until the damage is done. Your dry mouth may be telling you that your natural protection system is failing while you sleep. I want you to think about saliva differently from this moment on. Saliva is not just spit, it is defense. It washes away food particles, helps control bacteria, protects tissues, and supports your teeth every single day. When it falls too low, the mouth becomes more vulnerable, not just more uncomfortable. And that's where this next story becomes very important. George from Lexington, Kentucky was 74 and came in because his mouth felt sore and his lips kept cracking at the corners. He thought the issue was cold weather, but then he started noticing bad breath, a burning tongue, and tenderness under his dentures. He was brushing more, rinsing more, drinking more water, and still getting worse. What was happening? He didn't just have dryness. He had consequences of dryness. His reduced saliva had made it easier for irritation and infection to take hold. The symptom he ignored for months had quietly become an oral health problem that needed treatment. Signal number 3 is that low saliva may already be affecting your teeth, gums, tongue, or dentures. If you wake up with dry mouth and also have bad breath, sores, a rough tongue, painful gums, more cavities, white patches, or trouble chewing and swallowing, your body is telling you the dryness is no longer harmless. It is changing the environment inside your mouth. And once that happens, water alone is usually not enough. You may need a dental exam, a medication review, dry mouth products, fluoride protection, or treatment for an infection like thrush. This is exactly why persistent dry mouth should never be ignored. But the next signal is even more revealing because it often shows up outside the mouth entirely. And if you miss the pattern, you miss the diagnosis. Let me tell you about Sjögren from Scottsdale, Arizona. Sjögren was 72 and first mentioned dry eyes to her eye doctor. Then she mentioned dry mouth to her dentist. Then joint aches to her primary care doctor. Nobody connected them for nearly a year. She kept saying, I thought it was just, getting older. It wasn't. Her body had been giving multiple dryness signals at once, but because they showed up in different places, the message got scattered. Signal number 2 is this. If you wake up with a dry mouth and also have persistently dry eyes, unusual fatigue, dry skin, joint discomfort, or trouble swallowing dry foods, your body may be signaling an autoimmune condition such as Sjögren's disease. Not everyone with these symptoms has it, of course. But this combination matters. Sjögren's can reduce tear and saliva production and is often diagnosed after age 50. That's why I want seniors to stop normalizing all dryness as just age. Dry mouth alone deserves attention. Dry mouth plus dry eyes deserves even more. That pattern should make you pause. Sjögren finally got evaluated properly and everything made sense. The dry mouth, the dry eyes, the fatigue, the difficulty eating crackers without water, all of it belonged to the same picture. And here's the lesson. When your body sends a message in more than one place, the message is usually stronger, not weaker. The problem is that people often treat each symptom separately and never step back to see the pattern. So I want you to remember this. If your mouth is dry every morning and your eyes also burn, itch, or feel gritty, do not dismiss that combination. And now we arrive at signal number 1. This is the reason I saved for last because it is the one that frightens me most when seniors ignore it. It is common, underdiagnosed, and often brushed off as ordinary snoring. But if you wake up with dry mouth and lips plus the symptoms I'm about to describe, your body may be telling you something far more serious than thirst. It may be telling you that your breathing is being disrupted over and over while you sleep. Let me show you what that looked like in one of my patients because his story changed his life. Henry from Tulsa, Oklahoma was 70 and thought his only sleep problem was snoring. His wife said he sounded rough at night and sometimes got strangely quiet, then gasped. Henry woke up with a dry mouth every morning, needed water before speaking, and often had a dull morning headache. He was also sleepy in the afternoon and blamed that on age. But age was not the issue. His body was giving a pattern. Dry mouth, loud snoring, mouth breathing, non-refreshing sleep, morning headaches, and daytime fatigue. That pattern is not something I want any senior to dismiss. Signal number 1 is possible sleep apnea or sleep-disordered breathing. Not everyone who wakes up dry has sleep apnea. Let me be clear about that. But when dry mouth shows up together with loud snoring, choking, or gasping, morning headaches, daytime sleepiness, high blood pressure that's hard to control, or a partner who notices breathing pauses, the stakes rise dramatically. Why? Because sleep apnea often pushes people into mouth breathing, dries the mouth, disrupts sleep, and strains the body night after night. This is when dry mouth stops being a comfort issue and becomes a possible warning sign of a dangerous sleep problem. Henry underwent evaluation, and the result was exactly what his symptoms had been hinting at. Once his sleep problem was treated, 2 things improved almost immediately: his energy and his morning dryness. That's the part I want you to hear. Sometimes the mouth is not the disease. The mouth is the messenger. If you only chase the symptom with mouthwash, gum, or bedside water, you may soothe the messenger while missing the condition that created the message. And in sleep apnea, missing the condition can mean continuing to live with fragmented sleep and unnecessary cardiovascular strain for years. But there's one more twist here, and this matters to many seniors already using CPAP. Some people think, I can't have a sleep-related cause. I'm already being treated. Not so fast. If you use CPAP and still wake up dry, your body may be telling you the setup needs adjustment. A poor mask fit, air leaks, mouth breathing during treatment, nasal congestion, or missing humidification can all worsen dryness. I've seen seniors give up on CPAP simply because nobody solved the dry mouth problem around it. Sometimes the treatment is right, but the details are wrong. And details matter. So what should you do tonight if this sounds like you? First, take the symptoms seriously. Not fearfully, but seriously. Second, notice the pattern around it. Are your lips cracked? Do you snore? Is your nose blocked? Did a medication change recently? Are you thirstier than usual? Do your eyes feel dry too? Do you wake with headaches or fatigue? Your answers start narrowing the cause immediately. Third, improve the basics. Hydrate during the day, use lip balm, consider a humidifier, avoid drying alcohol-based rinses, and do not smoke. These steps help, but they are not substitutes for finding the reason. Fourth, look at your medicine list with fresh eyes. Include prescriptions, over-the-counter allergy pills, sleep aids, cold medicines, and anything for bladder urgency. If the timing matches, ask your doctor or pharmacist whether dry mouth could be a side effect. Fifth, pay attention to your nose and breathing. If you cannot breathe well through your nose at night, your mouth will keep paying the price. Sixth, protect your teeth and gums because dry mouth raises the risk of decay and oral infections. That means regular brushing with fluoride, flossing, and not postponing dental visits just because the problem feels medical. Now let me tell you when I do not want you waiting. If your dry mouth has lasted for weeks, if eating or swallowing is getting harder, if you have mouth pain, white patches, sores, bleeding gums, rapidly worsening bad breath, or sudden trouble tolerating dentures, get checked. If the dryness comes with frequent urination, excessive thirst, or unexplained fatigue, get evaluated. And if it comes with loud snoring, choking, gasping, morning headaches, or serious daytime sleepiness, bring up sleep apnea specifically. That conversation can change much more than your mouth. It can change your sleep, your energy, and your overall risk. I also want to say something important to every senior listening. Dry mouth is not a normal part of aging that you are required to accept. Yes, it becomes more common with age, largely because medications and health conditions become more common. But the symptom itself is still a clue, not a destiny. When your mouth is dry every morning, your body is not being dramatic. It is being specific. It is telling you that moisture, saliva, airflow, blood sugar, immune function, or sleep quality may not be where they should be. And that is worth your attention. So let's bring everything together. If you wake up with dry mouth and lips, your body may be telling you one of 8 things. You're mildly dehydrated, your room air is too dry, you're sleeping with your mouth open, your nose is blocked, a medication is drying your saliva, your blood sugar may be too high, your mouth is losing its protective shield, your dryness may be part of Sjögren's, or you may have sleep-disordered breathing such as sleep apnea. Some causes are simple, some are not. But the mistake is treating them all like they mean nothing. And that is why I made this video. Because I don't want you brushing off a real warning sign just because it arrives in a small, familiar form. Some of the most important messages the body sends do not begin with pain. They begin with dryness, fatigue, a cracked lip, a hoarse voice, a pillow by the bed, and a feeling that something is just a little off. Trust that instinct. If the symptom keeps returning, it deserves an answer. Your mouth is not overreacting. It may be trying to protect you by speaking early before the rest of the body gets louder. Take care of yourself, pay attention to what your mornings are telling you, and don't ignore what keeps repeating. If this helped you, subscribe, share this with someone over 60 who wakes up dry every morning, and let me know in the comments which signal surprised you most. Because the more clearly you understand your body's early warnings, the more power you have to act before small symptoms turn into bigger problems. And that, especially after 60, is exactly how you protect your independence, your health, and the years ahead. I'll see you in the next video.